IV placement is a vital skill for healthcare professionals. It is a fundamental procedure that ensures patients receive the necessary treatments efficiently and effectively. It allows for the delivery of fluids, medications, and blood products directly into the bloodstream. This method is often preferred for its speed and reliability, especially in emergency situations. This is essential for a wide range of medical conditions and procedures, from dehydration and infections to surgeries and chemotherapy. At Metro Health Institute, we provide comprehensive IV placement certification to equip aspiring healthcare workers with this crucial skill. Our program is designed to cover both the theoretical aspects and practical applications. Proper IV placement is not only about technical proficiency, but also about patient comfort and safety. It requires a gentle touch and a thorough understanding of human anatomy. A successful IV insertion minimizes patient discomfort and reduces the risk of complications like infection or infiltration. This is why proper training and certification are so important. Our certification program at Metro Health Institute combines theoretical knowledge with hands-on training. We use state-of-the-art simulation labs to ensure that our students are well prepared for real-world scenarios. We ensure that each participant gains the confidence and competence to perform IV placement safely and effectively. Our instructors are experienced professionals who provide personalized guidance. By obtaining your IV placement certification, you'll be well prepared to provide high-quality patient care in various healthcare settings. This certification opens doors to numerous opportunities in the medical field, enhancing your career prospects and enabling you to make a significant impact on patient health and well-being. Before you begin any IV placement procedure, it's crucial to have all the necessary supplies organized and within reach. This preparation is essential for ensuring that the process goes smoothly and efficiently, minimizing any potential complications or delays. This ensures a smooth and efficient process. Here is a checklist of the essential items you will need to gather before starting the procedure. Non-sterile gloves to protect yourself and maintain hygiene throughout the procedure. These gloves are crucial for preventing the spread of infection and ensuring a sterile environment. A tourniquet to make veins easier to see and access. This helps in locating the vein more efficiently, making the insertion process smoother. Antiseptic wipes to clean the area thoroughly. Proper cleaning of the insertion site is vital to prevent infections and ensure patient safety. Gauze pads to stop bleeding after the catheter is inserted. These pads are essential for managing any bleeding and keeping the area clean. An IV catheter, which is the tube that goes in the vein. This is the primary tool for administering fluids and medications directly into the bloodstream. Saline solution to flush the catheter and ensure it is functioning correctly. This step is crucial for maintaining the patency of the IV line. Transparent dressing to keep the area clean and secure. This dressing helps protect the insertion site from contaminants and allows for easy monitoring. And a sharps container to dispose of needles safely. Proper disposal of sharps is critical to prevent injuries and maintain a safe environment. Remember, having all your supplies ready before you start ensures a smoother procedure for both you and the patient. This preparation not only enhances efficiency, but also contributes to a more comfortable and safe experience for the patient. Patient comfort and hygiene are paramount. Ensuring the patient feels at ease is the first step in any medical procedure. This not only helps in building trust, but also in making the entire process smoother for both the patient and the healthcare provider, begin by washing your hands thoroughly. Hand hygiene is crucial in preventing infections and maintaining a sterile environment. Use soap and water, scrubbing for at least 20 seconds, or an alcohol-based hand sanitizer if soap and water are not available. Next, explain the procedure to the patient, ensuring they understand each step. Clear communication can significantly reduce the patient's anxiety and help them feel more in control of the situation. This helps alleviate any anxiety they may have. Reassure them that their comfort and safety are your top priorities. Apply the tourniquet approximately 3 to 4 inches above the intended IV site. This step is essential for making the veins more prominent and easier to locate. This helps to engorge the veins and make them more visible. Engorged veins are easier to puncture, which can make the procedure quicker and less painful for the patient. It's essential to ask the patient if the tourniquet feels too tight and adjust it accordingly. Patient feedback is crucial to ensure their comfort and to avoid any unnecessary pain or discomfort. Next, put on your gloves. Wearing gloves is a fundamental part of maintaining a sterile environment and protecting both the patient and the healthcare provider from potential infections. Choose a suitable vein, ideally one that is straight, bouncy, and easily palpable. The right vein can make the IV insertion process much smoother and less painful for the patient. Avoid areas with bruising, scarring, or inflammation. These areas can be more painful and may complicate the procedure, leading to potential complications. Once you've chosen a vein, it's time to prepare the insertion site. Using an antiseptic wipe, clean the area thoroughly. Start at the center of the site and move outward in a circular motion. Allow the antiseptic to air dry completely. This ensures maximum effectiveness in killing bacteria. Avoid touching the cleaned area after preparation. Now, hold the patient's arm steady with your non-dominant hand. This will prevent the vein from rolling away during insertion. Section 5, inserting the needle. With your dominant hand, hold the IV catheter at a 15 to 30 degree angle, bevel up. This angle facilitates smoother entry into the skin and vein. As you insert the needle, you should feel a slight pop as it enters the vein. Look for a flashback of blood in the catheter hub. This confirms successful entry into the vein. Once you see the flashback, advance the needle slightly further to ensure the catheter is fully inside the vein. Section 6, securing the catheter. After confirming proper placement, hold the needle steady and carefully advance the catheter into the vein. Release the tourniquet with your free hand. This reduces pressure on the vein and prevents discomfort for the patient. Next, apply gentle pressure above the catheter tip with your index finger. This prevents blood from flowing back into the catheter hub. Finally, remove the needle completely and dispose of it properly in a sharps container. Never recap a used needle. Section 7, dressing the site. Once the needle is removed, attach the prepped saline flush to the catheter hub. Flush the catheter gently to ensure patency. This also helps prevent blood clots from forming in the catheter. Now apply a transparent dressing over the insertion site. Make sure the dressing is secure and covers the entire insertion area. This helps prevent infection. Finally, loop the catheter tubing and secure it with tape. This prevents accidental dislodging of the IV line. Section 8, potential complications and troubleshooting. Even with proper technique, complications can arise. One common issue is infiltration, where the IV fluid leaks into surrounding tissue. Signs include swelling, coolness, and discomfort around the IV site. Another complication is phlebitis, which is inflammation of the vein. This can cause pain, redness, and warmth along the vein. If you suspect either of these complications, stop the infusion immediately and remove the IV catheter. Remember, if you encounter any difficulties or complications, don't hesitate to seek assistance from a qualified healthcare professional. Section 9, safety first. Always prioritize safety during IV placement. Engage the safety mechanism on the needle immediately after removal to prevent accidental needle stick injuries. Dispose of all sharps in designated containers. Remember, proper IV placement is crucial for patient well-being. By following these steps and practicing diligently, you can master this essential skill and provide safe and effective patient care. At Metro Health Institute, we're dedicated to providing comprehensive training and ensuring your success in this critical aspect of healthcare.